Hello, I am Dr. Marc Glickman, and this is a Society of Vascular Surgery briefing about group practice models for vascular surgery. I am presently Director of Vascular Services for Sentara Health Care in Southeastern Virginia. We are a group of 16 vascular surgeons and 2 transplant surgeons that cover 8 hospitals. We are presently owned by an integrated healthcare system. The physician part is a multispecialty portion that has over 385 doctors. Our group practice model is quite well defined. We have a practice management committee, or PMC, made up of 4 physicians, practice manager, service line manager, and myself as director. We meet on a weekly basis discussing issues of the practice as well as strategic planning for the group. We meet for 1.5 hours discussing budgets, HR issues, quality assurance, and maintenance of the schedule and call issues. These sessions are working sessions helping to define the direction of the practice and attempting to deal with all issues before they become too large to handle. Each practice management physician acts as a communication liaison to several of the division members. The division members meet monthly. We rotate the meetings to include clinical issues, business issues, and mortality and morbidity discussions and cases. The purpose of these meetings is to educate and for many of the members to feel a part of a larger group. The division members vote for new practice management committee members. They vote on salary and productivity issues and have the final say to vote on recommending termination of the group to the Sentara Medical Group. Our practice model incorporates well-defined rules, equality on all issues. It is the practice management committee that helps lead the way and helps make sure the vision, the quality, and the commitment of the group are met. The director of the group is allowed to represent the group at hospital and administrative meetings and to negotiate for new venues for the group. The administrative members work on budgetary issues, HR issues for employees, implementation of electronic medical records, and to represent the interests of the group to Sentara Medical Group administration and board. From a financial model, we are mostly a group think model with all the money divided equally among the division members. We have only a very slight productivity measure to reward extra hard work. When our group was purchased by the healthcare system, we implemented an entrepreneurial factor to the model of the group practice. The healthcare system requires us to complete and maintain our work RVUs, but also allows for independent work through our vein centers, our angio and endo suites, as well as our research practice of the portion of the practice. This allows us to continue to be creative, continue to be successful, and to look at ways to generate new revenue sources for the practice. Our commitment in being acquired allows for the group to expand with new opportunities and excitement. There are several other group models that are also available for group practices. This includes sharing in overhead, or an eat what you kill model, coverage and associated expenses. Although quite successful, these models do not allow for movement into growth areas, as these areas may not be as profitable for some time. Therefore, no one wants to expand into these areas, resulting in a decrease in income. This is where hospitals play a significant role to help guarantee economic support for physicians to practice and set up in their hospitals. Other models include a management team, shared expenses with a model similar to what we have developed, but with more focus on productivity and rewarding higher earners significantly. This model has been extremely successful in other areas and often becomes the basis for models and practices throughout the United States. In conclusion, a group model that is successful depends on defined rules, successful physician leadership, and a thorough and open understanding of the economic venue of the group. Fairness and equality should become the hallmark of any group model. This briefing is made possible by a grant from Cook Medical. To learn more about vascular health careers, visit vascularweb.org.